Chairman, and I certainly share Senator Merkley's view on this point. And the reality is, on this side, we have been trying to work with Republicans on fighting healthcare fraud again and again. I went to the floor repeatedly to point out, for example, insurance broker fraud, something that both of us ought to come together. No response from Republicans. So today, we're looking at yet another approach that is ill-advised because it primarily hurts people and doesn't do anything about reducing fraud or anything like that. And that's the administrative trap designed to disenroll folks who are eligible for Medicaid. And the Trump administration went forward to basically say that they were going to literally require people to prove that they're sick enough to deserve health care. So today, Senator Warnock and I are releasing a letter signed by each Senate Democrat urging the Trump administration to pull back on this disastrous rule that would harm so many vulnerable people. So this, by the way, is the same sort of approach that House Democrats have taken to raise the alarm on this flawed and hurtful rule. I can't remember the last time that we had such unity between the House and the Senate, but I guess if the Republicans are just going to keep hurting people, you'll see it often in this session. I'd like to ask, Mr. Chairman, that these letters be entered into the record.
No objection.
Thank you, Mr. Chairman. Now, Andy Schneider may not be known to everybody in this room, but I sat next to Andy Schneider when he was starting his career in healthcare, and he was fighting for people who were vulnerable, people who walked an economic tightrope and balanced the food bill against the fuel bill and the fuel bill against the rent bill. And he's still doing that. My God, this is a man who could probably go out to any mega corporation and pull down a gigantic salary. But instead, what he's doing is putting his heart out there once more for people who are walking that economic tightrope. So before we wrap up, I think it would be great to have Andy Schneider give us a real-world example of the human cost for the millions of Americans who are losing their health care as a result of this bureaucratic razzmatazz. That's the most complimentary thing you can talk about because it really is bureaucratic unfairness. But tell us what it means to people who are hurting and vulnerable, that you've been fighting for, by my calculus, for almost a half a century going to bat for people who didn't have clout and didn't have power.
Thank you, Senator. I appreciate that. And I fondly remember our days in midnight basketball in Portland.
Don't talk about my Grey Panther days.
Okay, I withdraw that comment.
Thank you.
You had a great dunk, though. Good. So let's take what is the unfolding story here of work reporting requirements being imposed on all Medicaid expansion states for Medicaid expansion adults. And one of the first states out of the box is Nebraska. And there was a piece yesterday or the day before reporting on some of the early administrative red tape problems that Medicaid beneficiaries are going to face as this unfolds.
It's a backdoor disenrollment program, isn't it?
Well, I think that's a fair characterization, yeah. So in this particular case, a pregnant woman was disenrolled from the Nebraska Medicaid program because the enrollment staff didn't understand that she was pregnant. So it eventually got sorted out, as far as we can tell from the reporting, but these kinds of errors are almost unavoidable given the complexity and cumbersomeness of the new rules that are about to go into effect.
Well, I thank you for putting a human face on this. We're going to be calling on you in the Finance Committee as well on the same point. And before I close out my time, Mr. Chairman, Ranking Member Merkley asked members on the dais to share stories from our states, from families who rely on Medicaid. I'd like to enter into the record the letter from 11 U.S. senators to Dr. Oz that highlights families all over the nation, from one end of the country to another, who need help, need assistance with community-based services, and particularly need Medicaid. I ask unanimous consent that I close out my remarks with that.
Without objection.
In this exchange, Senator Ron Wyden makes a broader argument than simply criticizing one Medicaid policy. He is challenging what Democrats see as a recurring approach to healthcare policy, using administrative hurdles in the name of accountability, while shifting the burden onto people who are already struggling. Wyden argues that if lawmakers are genuinely serious about reducing fraud, they should focus on sophisticated fraud schemes involving bad actors rather than creating new paperwork requirements that eligible patients must navigate just to keep their health care.